Good morning. Thank you all so much for joining us today on this beautiful cloudy day. Really appreciate you all hopping on for our training. As you know, our training is in regards to the New Mexico abortion laws. So really talking about the landscape for abortion access and how it has drastically changed since Roe versus Wade was overturned this summer. And so we were talking about how these changes are and can affect survivors of domestic violence. And we are joined today by and with Ellie Rushworth. She's an attorney at the ACLU of New Mexico, where she has had the privilege to work and protect to expand access of reproductive rights and gender equality for all New Mexicans. So we're really honored to have her on here and to really answer all, the questions that we all have. I know that this topic has been it's a really important topic, and a lot of us have a lot of questions, and so hence why we created this training. So please feel free to ask your questions in the chat. You can put them also, for those of you that are joining us on Facebook, you're more than welcome to also share this and put your questions in the comment box if you need to. We do want to address everybody's questions, and this session is also being recorded. So just in case you want to go back and say, oh, I forgot, did she mention this? And just for clarification, or you want to share it as well. We are going to have it on our YouTube channel in a couple of days. You will also receive a certificate from me from attending the session with that email. I will be sending that email in a couple of days. I want to send just one email with the recording, the survey. Let us know if you have any more questions. When you take that survey, there's also an opportunity for that if maybe you weren't able to ask your question during the session. And so with that being said, I'm now going to turn it over to Ellie Rushforth. Again, thank you so much for being here with us and supporting us with all the questions that we have.
Thank you so much. And thank you everybody for being here and for, sharing your morning with me. So my name is Ellie Rushworth, I use she, her pronouns. I am the managing attorney for reproductive rights and gender equity at the ACLU of New Mexico. I was born in Las Cruces, moved away, graduated from UNM, went away for law school, and finally navigated my way back home. And so I'm really grateful to be able to be home and to be working in my communities and with you all, right, during some really challenging times. And so, as I was preparing for this conversation, I've done a lot of these. I've done a lot of, updates, debriefs, information sharing, thought partnership, all of the things since the Dobbs decision came down. And this one, this presentation, was probably the first one that I was struggling to put together. And I think part of that is I wanted to hear primarily from you all. I wanted this to be more of a shared learning space, a conversation, rather than me talking at you for an hour about, sort of the developments in the law and the policy, right? Because that's not what matters to our clients. That's not what matters to our patients. What matters is sort of the practicality of everything. And so, I put together a little presentation and an agenda and all the things. But I wanted to make sure primarily that we have time to answer questions, right? And so I am an attorney, not your attorney. And so I won't be able to answer a super specific questions about a specific patient, a specific client, a specific circumstance, but I can do my best to provide some resources and guidance and clarification. I have no financial disclosures. I'm a nonprofit attorney. And I'm trying to think what else. Yeah, so that's sort of where I'm at. So if you want to drop questions in the chat or, DM me directly if you don't want to ask them publicly, or, to whomever, that's fine. And we'll sort of compile them and make sure we get to them. And so to the extent possible. So I am going to share my screen, or I'm going to try to. because I did put together this little agenda. Let me see if I can get there. Okay. Bear with me. Okay, did that work?
Yes.
Okay, can you all see here? Let me get into and you know what I'm actually going to do? There we go. Okay, I'm so sorry. Bear with me. So, you know, there are quite a few of us, and so I don't think we'll be able to get to all of our introductions. But if you wouldn't mind dropping in the chat your name, your pronouns, one thing you want to make sure that we talk about today, and where you're located regionally in the state. You know, I'd love to know where people are joining in, and if there are specific questions related to your region, that would be great. And so, sorry, I'm just getting myself a little settled here. So this is sort of my agenda for today, right? Talking about the abortion landscape in New Mexico nationally, and specific intimate partner violence and sexual assault related flags and questions. I want to keep it useful, you know? And so my goals, these are the goals that I've got. And if there's anything you want to add to that, again, just drop it in the chat. So, you know, I want to make sure that you all know what the legal landscape is like here in New Mexico, and what the specific flags and red herrings are that you may experience with your clients, your patients, and answer questions and understand our rules. So in New Mexico, let me drop back a little bit. So we're talking about abortion care, abortion law specifically today. But we also know that this is just one piece of the puzzle with reproductive health care, reproductive rights, and reproductive justice. And you all know this better than anyone, right? You work with complex clients, complex patients who are experiencing the intersection of a whole number of the intersection of the law, the intersection of healthcare, the intersection of violence, of oppression, of coercion, all of these pieces that folks who are not necessarily client and patient forward are going to have a deep understanding of. And so, yes, we're talking about abortion rights today, but we're also talking about so much more than that. And so here in New Mexico, and I'm going to skip a couple of these, which is my favorite thing to do in a presentation. So regardless, if you're married, in a relationship, single, under 18, you have reproductive rights. You have the right to receive accurate information and make your own sexual and reproductive healthcare decisions. You do not have to get anyone's permission to access sexual and reproductive health care or domestic violence services or intimate partner violence services. You have the right to receive care without discrimination. And your patients, your clients may qualify for free or low-cost care through the Department of Health Family Planning Program, or access abortion care by utilizing abortion funds. And so I'll talk a little bit about that at the end if you have questions. Very important here in New Mexico, particularly for people in complex family situations, intimate partner violence situations. If you're under 18, or if you are a dependent, or if you are married, you still have the right to confidential health care, including abortion care, contraception, mental health care, substance use care, all of those pieces, you have the right to access them confidentially and without fear of criminalization. Practically, it gets more complicated. And Sarah and I are going to talk a little bit about that later. Also in New Mexico, you don't have to get anyone, I already said this, right? But you don't have to get anyone's permission to have an abortion, to have a baby, or to access contraception, get tested or treated for STIs. You don't have to tell anyone about your reproductive healthcare decisions. And you don't have to tell your healthcare provider your citizenship or residency status. Lots of healthcare providers, and many of you all know this, right? You go in, you fill out your forms, all the things. But for lots of folks, particularly in the borderlands, and I know you all know this, we live within the 100-mile border zone. And so it's not necessarily safe for everybody to disclose their citizenship status or residency status. This also particularly comes up in the intimate partner violence world, right? When people weaponize, when abusive partners weaponize access to the court system, citizenship, lawful permanent resident statuses, all of those pieces layer on, making it more difficult for somebody to access healthcare. One other thing that comes up in New Mexico, we have organizations called crisis pregnancy centers here. They are entirely unregulated by the state. Their mission, many of them, if not all of them, are faith-based. And the vast majority of them in the state of New Mexico are run by two out-of-state entities whose mission is to dissuade people from exercising their personal autonomy, sovereignty, decision-making around their reproductive health care. And their specific mission is to discourage people from accessing abortion care. And often they will provide people who come to their centers with false information, misinformation. And so it's particularly important for us in the service provision and client facing world to understand that where we're sending our clients, our patients to get healthcare, to get services, to understand where we're sending them. And so I realize I'm talking a lot about the law and some of these hyper technical pieces. I almost want to get it out of the way, right? These are the pieces that, and I'm going to pull up the chat. These are the pieces, yes, it's most important for you all to know front facing. Your clients, your patients continue to have the right to access this kind of healthcare confidentially and safely here in New Mexico, regardless of what's happening at the national level. I know there are a lot of questions about folks who may be coming to New Mexico to access healthcare and are also accessing your services, and I'm happy to talk more about that. But for this piece, it's just particularly important, we're all New Mexico service providers here, to understand that our clients, our patients still have this right to access abortion care, but also access full scope reproductive health care, and do so confidentially and without a lot of the medically unnecessary and dangerous restrictions and burdens that other states have put on healthcare.
Ellie, can I
Yes.
interrupt and ask a question? So when, people are asking about where to go and stuff, is there any recommendations you have to really find the crisis pregnancy centers versus real clinics? How can you tell? Because they do really try to put out that they're they're clinics that actually provide abortion care?
Yeah, that's a really great and important question. So the Southwest Women's Law Center has, where Sarah and I both used to work at separate times, has recently put out a report about crisis pregnancy centers. And there's also a web, and Teresa, why don't we send out some of these resources at the end? There's also a website that has all of the fake clinics listed that do not offer healthcare, right? That's not to say that some of them may have a nurse volunteering, some of them may have, a medical director, but the vast majority of them are, none of them are licensed medical facilities. That's the reality. None of the crisis pregnancy centers in New Mexico are licensed to provide medical care at those facilities. And their websites would look like they might. And so it's really important for folks to understand what they're walking into. And so if folks make the decision to go to a crisis pregnancy center for whatever reason, it's really important that they understand what they're walking into. And so we will I'll share some resources that can go out to this group with more information about what these facilities do and don't do. And, they can, so yeah, we'll send out some more information. Really great question, because it's hard to tell, right? You'll see words like pregnancy options. You'll see words like pregnant and scared, that would imply that if you go to one of these facilities, you will get some sort of pregnancy related services. And that's just not the case. And so we'll send out some follow-up resources. Again, right, this is the perfect coalition to talk about informed consent, to talk about coercion, to talk about power and control, because you all see it and understand it in a way that many others don't. And so we can't talk about reproductive rights, we can't talk about reproductive health and justice without talking about power and control and how these dynamics are playing out for our clients, for our patients, in their real lives. And so I'm gonna just take a quick pause and glance at the chat to see, let's see.
There was one question where, want to know the ability wait times people are, how that looks like, and how that might change in the upcoming months.
Got it. Yeah, that's really important. So couple things. Because many of the states that are surrounding our state, our communities, are taking away their residents' rights, we are seeing an influx, right, of people who need healthcare. And we, I don't need to tell any of you this, right? We're a small state, we're a rural state. We already have a lack of access to healthcare in our broader communities. And so what we're seeing now are across the country, we are seeing and experiencing an obstetric and gynecological crisis. We are experiencing a public health crisis, a maternal morbidity and mortality crisis, and an infant morbidity and mortality crisis. The WHO recently released, the World Health Organization recently released findings that suggest our maternal mortality rate, maternal morbidity and mortality rate will increase because of these abortion bans 24%. For Black women, it's 40. And so when we're talking about an influx of patients, an influx of community members into our state, it's important to remember that this is like all healthcare, right? It's healthcare. It's life-saving. It's not optional. And so availability, wait times continue to shift. And so we also have existing providers who have extended their service hours. They are offering telehealth and telemedicine where possible. And it's important to remember a lot of the abortion providers in the state, in fact, all of the abortion providers in the state offer care beyond that. So we're talking about contraception, we're talking about prenatal care, we're talking about, so we have everything in our systems of care, from the smaller independent clinics who offer, contraception and abortion care, and general family planning care. And then we've got our large systems of care. And so folks are extending hours, they're hiring more staff, more providers are moving here, or providers that have been here for a long time are adding abortion care to their practice. What this doesn't address are the delays that are, of course, going to happen in people accessing sexual and reproductive health care when there are more people needing that care, right? And so, wait times are often in flux, and it has impacted people's ability to get care, other kinds of healthcare, other kinds of sexual and reproductive health care as soon as they would like. And so, when we're talking about access to healthcare, when we're talking about wait times, we're talking about people not being able to get what they need when they need it. And in our rural state, it's not always an option just to pop over to the pharmacy, to pop over to your local family planning clinic, because they sometimes don't exist. And so our infrastructure, our public health infrastructure, which again, I think you all know this, and our sexual and reproductive health infrastructure in New Mexico and across the country has been taxed for decades. And so the idea that, our clients, our patients are not going to face challenges in accessing what they need is just a fiction. And so that's something advocates, clinicians, policymakers are working on figuring out how to rise and meet not just the sexual and reproductive health needs of our communities, but so much more broadly than that. I'm gonna pop over into the questions. There was another one that I saw.
Ellie, there is another one about transportation for abortion care in rural New Mexico.
Yeah. So really important and complicated question. So unlike states like Texas, Mississippi, Missouri, I think at this point, I think 13 or 14 states have banned abortion care, and supporting providing that care. Here in New Mexico, there are a couple of different ways that people get to where they need to go. And it's all the same ways that you would do that for any other kind of healthcare. But specifically for abortion care, there are abortion funds And we'll follow up with these in the resource list. But in New Mexico, we have 3 abortion funds and access to national abortion funds that can help with transportation. So we've got the Mariposa Fund, the Indigenous Women Rising Fund, Religious Coalition for Reproductive Choice, the National Network of Abortion Funds, and the National Abortion Federation. And all of these organizations work directly with patients and providers to help patients get what they need. And so those are some of the ways that patients can directly access transportation. We also, in New Mexico, abortion care, because it is healthcare, is covered under our state Medicaid. And so we have New Mexico Medicaid transportation, and I'm so sorry, I'd have to Google exactly what it's called. I think it's Centennial Care Transportation or something. Underutilized, certainly, but a possibility for folks who are Medicaid participants and members to access that care to get where they need to go. And so those are some of the transportation options for folks in rural New Mexico. Some of those considerations get more complex, right? So if some of your clients, your patients are undocumented, right? It gets more complicated, right? Because if you're in southern New Mexico and you're below the 100-mile border zone, there are some additional considerations for how people navigate their freedom of movement. And so again, it's something that people need to consider carefully and cautiously when they're recommending where people go to access healthcare. Now, Las Cruces has has two abortion providers that are able to help people in southern New Mexico, which is, and those also offer other services as well. And so that's something to consider. Let's see, there are a couple more questions that I want to make sure. Okay, victim advocate. Yeah, so we've got a question about young people seeking medical help without parental involvement, consent, including for abortion services. So young people and people who are pregnant have the capacity to consent to their medical care. And, I think this is again where some parts of like clinical judgment and advocacy come in. And so when working with young people, when working particularly with people in intimate partner violence circumstances and survivors of sexual violence, again, this is where that clinical judgment, that working with your attorneys, if you have them, getting specific legal advice is really important. But here in New Mexico, young people do have if they are pregnant, do have the capacity to consent to that medical care. I believe the same is true for mental health services and substance use services. So, these sensitive services that young people need also come with risk in a lot of families. And we know that we can't legislate healthy family dynamics, healthy family communication. And so that's why it's particularly important that young people are able to make these decisions in consultation with, a trusted adult, a trusted advocate, without government interference or forced parental involvement. One thing we do know is that the vast majority of young people include a parent in their decision to get an abortion. I think the American Academy of Pediatrics, I think the statistic that sticks in my mind is something like 80%. And for those that can't, they are including a trusted adult. And it's just not safe for them to include a parent. And so that's, the answer to that question. And that is true. If somebody is coming here from another state to access healthcare. And so, not oftentimes, what we're seeing now are young people coming with their parents from other states to access care that has been banned in their home state. And so, yeah. So I've been talking pretty straight at you for about 30 minutes. And I wanna, make sure and take a pause to see if there are any questions, concerns that are coming up from what we've talked about so far before we kind of jump into the specific flags, red herrings, myths around abortion care and intimate partner violence. And so I'd like to talk a little bit about that next, and then after that, talk about the national landscape. But before we get into that, I just want to pause. Okay. So, some of the specific flags that come up, right, in intimate partner violence situations, in sexual violence circumstances, have nothing to do with the law, right? They have nothing to do with the right of the person to access medical care. It's about the safety of that person accessing medical care. It's about their ability to use their insurance. It's about their ability to move freely. And so I wanted to, ask Sarah if you wanted to talk a little bit about, the confidentiality and safety pieces, because it's, those are some of the most practically important pieces for survivors.
Absolutely. Hi, everyone. My name is Sarah Coffey. I am here just in my independent capacity. As Ellie said, I used to be an attorney at Southwest Women's Law Center back in the day, so I had some experience in this world. One thing that really I would flag is this idea of insurance. I think that that's one of the most important things. Luckily, in New Mexico, we have access still right now. And a lot of insurance companies actually do cover abortion care in New Mexico right now. But when survivors are in situations where they need care and they are in a situation where their partner might still be part of the household, I guess let's start with that kind of hypothetical first. The important thing to remember is if you utilize insurance that you share, insurance sends documentation of things. And that is something that is, I think, overlooked, yet at the same time, people are also very aware of it. It really depends on who you're talking to. It is either it's 100% on their mind or 0% on their mind, in my experience. I don't feel like there's a whole lot of in between. So a couple of things to just remember, if you're sending someone or if they're talking to you about care, is talking to their insurance company, watching the mail, things like that, because insurance companies will send explanations of benefits where they will explain what medical care was provided. And this goes to the insurance provider. I mean, so if the abuser in your situation is the primary person on the insurance, that's who it's going to. And so you want to make sure that people know that there is a possibility of that. So sometimes, even if they have insurance, insurance might not be safe to use. Doctors also send communication. I think that, in all honesty, of all doctors, I think abortion providers are probably some of the best that really talk about like consent, about where to send things, what can be sent, that kind of stuff. But regardless, making sure that there is a safe address that's been given for, say, billing errors, because we all get those fun bills from doctors occasionally. I just dislocated my knee, so I'm getting a whole bunch of them. It's super fun times. You never know what's going to be in the mail. So it's really important that they know to kind of watch the mail coming in, if they're living with the abusive partner, or if that they're on that person's insurance. Also making sure to know who has consent to get their medical information. A lot of times people are like, oh yeah, my partner can learn about, my pimple or whatever. You might want to really limit that and talk to your doctor about what's in your records, just to make sure that it's not accessible. Doctors are not supposed to have certain conversations with anyone else in the room. I would like to share one of my client stories, because she has been very vocal about this and has done a lot of trainings for medical providers in the past. So I just want to flag the situation. She is in her early 30s and she has 8 children. Her abuser, in her words, kept her pregnant throughout. And she asked pretty much any doctor, anytime a door was closed and he was outside of that room, to sterilize her. And that was a constant request. But so those are things, I really just want to point that out. Eventually, after she got away from him, she found someone to take that action for her, not while she was still in his control. So make sure if you're talking to people, let them know that the providers are supposed to be meeting with them alone. And if that's not happening, tell them to let someone know, because someone can reach out. You can reach out and call the provider and say, hey, you met with, so-and-so on this date. You left a partner in the room, and that actually creates a safety. Like, not got to work together to teach people things. So that's an important thing to do. I will say that I think that the abortion providers are much more cognizant of that than most other providers, honestly. What other things should I touch on, Ellie, that we were thinking of? I think that's pretty much it.
Yeah, one thing, so we've talked about basically ensuring the safety plan, right? I think, you all are so cognizant of this, and I couldn't agree with Sarah more. I have the privilege to work with abortion providers really regularly, and these are some of the most trauma-informed, culturally congruent providers that I get to work with, right? And it's because they understand consent. It's because they understand the power and control that a lot of people are subject to, particularly if you become pregnant. And so, the safety plans with respect to explanations of benefits from the insurance company, from calls from your pharmacist in case you have any medication to follow up with, things like that. Absolutely. It's also important with patients and clients. I think many of our abortion providers do a good job of preparing people. But if somebody is going to an abortion clinic, they are going to experience harassment and violence from anti-abortion extremists and protesters that are standing outside of these healthcare providers. And given it's a really hard thing for me to say out loud. Every time I say it out loud, I get so angry. because, well, for obvious reasons, but nobody should be screamed at, nobody should be shamed, nobody should be photographed, recorded when they're going to their doctor's appointment. That's just not, it's not a reasonable thing. And so, you know, if you are working with patients, clients, folks who, you know, you may or may not actually even be getting an abortion, right? But if you are going somewhere where abortion is offered, you will likely have to walk a gauntlet of anti-abortion extremists who will be recording you, they will be screaming at you, and they will be calling you names. And, you know, working with a population, working with folks who are already experiencing violence, and I don't want, you know, people need to access the healthcare that they need, but being prepared and understanding what they might experience is really important. And not engaging with anti-abortion protesters, not engaging with those folks, you know, is not, well, that's just sort of the best course of action, right? Things are really escalating around the country and in New Mexico right now. Anti-abortion extremists are coming from all over the country to harass our communities. It's really important to understand for your clients, your patients, to understand that they are making the best decision for themselves. And it does not matter what those folks standing and screaming at them have to say. And so, you know, being mindful, you know, these are folks that already are experiencing violence in one way or another, you know, and the fact that, you know, these anti-abortion extremists are willing to perpetuate that violence is pretty telling. And so I would just encourage people to talk, if folks are needing this kind of healthcare, to talk with them and help them prepare for that. You know, another thing that is really important is that a lot of these anti-abortion folks are recording. And I've said this already, but I want to drill down on it. Many of them are wearing GoPros. Many of them are taking pictures of license plates. Many of them are engaging directly, right, with cameras and faces. And, you know, for somebody who is accessing these services, who is in an intimate partner violence or sexual violence circumstance, you know, I can't even imagine how triggering and terrifying that is. And so again, it's a matter of preparation and safety. And if somebody does cross the line, understanding that that is not okay. You know, if somebody does prevent them from accessing healthcare, if somebody does prevent them from, you know, going into or coming out of, or is being really threatening, it's not okay. People don't have the right to do that. And so if you are hearing of cases where people are getting harassed and stalked and doxxed, please know that that is not okay. That is not legal. And you know, we would want to hear about that. And so, yeah, that is always a really hard thing to talk about. But it's also just, you know, folks are used to navigating really hard, you know, people in these, people are really used to navigating hard situations. So it's an unfortunate thing that we have to manage. And so those were some of the pieces I wanted to make sure to talk about, because we are experiencing a level of heightened violence, heightened attention, particularly going into this election season. You know, folks are really pushing the boundaries of what is okay. Well, I don't think any of this is okay, but pushing the boundaries of what is legal. And so, you know, this is all really, yeah, a lot of this feels really theoretical right now. We're talking about it, and so I want to make sure that if that folks know that those of us at the ACLU and other advocates, like we are here to help you. We are here to help your clients and your patients navigate this world. And I'm really hopeful that New Mexico will continue to be a place where people can access the healthcare that they need, and that all of us need to work together to make sure that that remains the case, but also that our patients, our clients, can navigate an increasingly complex system where their medical decisions are politicized, where their bodies are politicized. And so with that, I just want to shift a little bit to some of the national and other state pieces.
Can I jump in one more time real quick? Yeah. Those of you who know me are used to me jumping in and talking all the time. One thing that I just want to point out that we're really used to watching in our kind of cases is this idea of like electronic monitoring and things like that. We're used to, abusers monitoring emails, cloning phones, doing all of these things. That is going to be really important to know what you're saying and where you're saying it. For their direct safety. But the kind of creepy thing, and I think this is one of the things Ellie's going to get into now, is the national landscape is kind of almost parroting some of that behavior. And now people seeking abortion care really need to be watching their electronic records, not necessarily because of their abuser, but because of criminality. So making sure that you talk to people about, is your email secure? If, your doctor communicates, or if your mother communicates with you about this, if you're talking to them, if you're talking to your aunt via text message and telling them what's going on, making sure that those things are not something that the abuser has access to. And this is whether or not that person is necessarily a part of your life or not. The abortion care is one of those things that I would put up in the same kind of levels as leaving the relationship. And when victims are trying to terminate a pregnancy, if their abuser does not want that to happen, can really cue some very, very violent responses. So even if the relationship is ended and the person is away, like making sure that that private information stays private and working to ensure that through watching your text stuff is also an important thing. And then I'll turn it back over to Ellie.
No, you read my mind. I mean, it's that was a big part of the framing where I was going, but it's where I was going is from the state level, right? It's not the state, but like the state surveillance apparatus, but yes, it is partners, it is family members, it is whomever has access to your digital data. You just can't take that sort of thing for granted. And I think we all know that in this space. So zooming out a little bit, abortion has either been banned or criminalized in one way or another in over half of our states. I think I can't remember exactly off the top, but I think it's 13 or 14 states have banned abortion almost entirely, which means 80 million people, 80 million already do not have access to a single abortion provider in their state. And a big part of the shift in these laws is the criminalization, is the creating private rights of action, the ability to sue helpers, providers, and even patients themselves in certain circumstances for helping, providing, or accessing abortion care. We've seen for, hundreds of years, but in the last couple of decades, the weaponization of our criminal legal system to punish and incarcerate women for their pregnancy outcomes, whether it's a pregnancy loss or a self-managed abortion. We've seen multiple women, dozens of women that we know of. The majority of them are young women of color, immigrants, or people who are poor, be investigated, criminalized, and locked up for their pregnancy outcomes. And a lot of the mechanisms that have been used to do that are digital surveillance and people reporting on their loved ones or their patients. And so, you know, in the intimate partner violence world, in the sexual violence world, you know, folks are already experiencing oppression and violence, power and control. And when you add on the state surveillance system, the community surveillance system, using the same tools, yeah, I can talk about trigger laws, to monitor not only what you're searching for, right? Not only did you search for abortion pills, did you search for abortion clinic, but monitoring who you're talking to, what you're talking about, where you go, did you go to this clinic? These are all tools that were not available 50 years ago. And so when we talk about going back, I don't think we're going back. We're going somewhere worse. And so, you know, Sarah and I are both lawyers, right? And so I'm sure you're all used to the lawyers ringing alarm bells and talking about risk and risk mitigation. You know, for patients, clients who are maybe from another state or have left an abuser in another state or may or may not be going back. These are all things just to be mindful of when you're talking to your patients, your clients about their safety plans. And so, you know, here in New Mexico, you know, if somebody comes here and gets healthcare here that is legal here, they should not face criminal or civil liability when they go back home. We are still in the early stages of states banning abortion and prosecutors and, you know, your average citizens figuring out how they want to weaponize these laws and how they want to utilize the tools that the Supreme Court has given them to force people to remain pregnant when they don't want to be. And so being mindful of where your patient is going back to, or your client is going back to, or you know, what they're taking back with them is really, really important. And so, you know, somebody coming here to get care is legal, right? There's not a state that can reach into New Mexico and say, no, you cannot provide this person healthcare completely within your boundaries. It's not to say that they won't try, but that is, you know, patients that are coming here should be able to legally access healthcare. Again, it's not to say that a family member, an abuser, an anti-abortion prosecutor, politician could not put a target on somebody's back. And that is exactly what these laws do. You know, they're putting targets on people's backs. And so as we enter sort of this new era in accessing abortion care, you know, just as your clients, your patients are used to navigating complex and dangerous situations, this too requires thoughtful and yeah, just thoughtful, just being thoughtful. And, you know, I wish it were as simple as I've decided I don't want to be pregnant. I'm going to get an abortion. I'm going to go to my clinician and I will get the care that I need. Theoretically, it should be that simple here. And legally it is. Practically, it just gets more complicated, particularly with people in vulnerable situations. And so I saw there was a question, okay, trigger laws and how that can affect. Yeah, so trigger laws are laws that were on the books in other states. We had a trigger law that we have since repealed, our pre-Roe abortion ban, thank goodness. Everybody said, don't worry, Roe's not going anywhere. We saw the writing on the wall. So trigger laws are pre-Roe abortion bans, many of which criminalized with felony criminal penalties for people who provide help or in some cases access abortion. To my knowledge, those specific kinds of laws have not yet been used to prosecute pregnant people or people who've had an abortion. What we are seeing are prosecutions under, child abuse and neglect laws, the criminalization of substance use, investigations into, not reporting, a pregnancy loss, things like that. But so these trigger laws are basically abortion bans from before Roe. And right now, there's some litigation going on around the country about several of them. But what has happened is anti-abortion politicians and policymakers have really created a layered system that, combined makes it next to impossible, even if abortion hasn't been banned, for people to access care. We're talking about multiple visits for no medical reason. We're talking about forced medical medical procedures for no medical reason. Bans on health insurance and Medicaid from covering the cost of abortion care. State mandated misinformation about what abortion and contraception mean. Forced parental involvement and notification. All of these things weave together to make it hard for people to access the care that they need. And so, we're seeing the tide really shifting from even just a few years ago, where, the rhetoric has always been extreme. But in the last couple of years, the rhetoric around pregnant people and the decisions pregnant people are making and their doctors has shifted in a way that is particularly frightening to me, because we are zeroing in on patients and providers in a way that, in a criminal way, that is going to make it even more difficult for people to get the care that they need. And, the practical consequences of these abortion bans. And it's not going to stop with the abortion bans, right? We know this. In the Dobbs decision, Justice Thomas was laying out the roadmap for where the Supreme Court and where, anti-abortion and other extremists are going. I think it was Ohio, just one of the universities just stopped providing contraception, right? This is where we're going. We're going to a place where contraception, emergency contraception, intimate, decisions about, your intimate decisions you're making in the bedroom and in your marriage, or in, any kind of relationship, are at risk for state surveillance, state intervention, prosecution, and criminalization. And I don't have to tell this group the dangers of that. And so, I guess my ask is, I hope that we can continue to work together to make sure our clients and our patients can make the best decisions for them, whatever it may be, whether it's having an abortion, having a child, move it, whatever decisions our clients, our patients decide to make, that they can do that safely and legally without the fear of violence, whether it's at the hands of an abuser or the state. And so, wow, it got really heavy there at the end. So I'm going to ask, that as we move into these places where policies are being decided that will impact our clients and our patients' lives, that, great question. So it is not illegal to mail, okay, that's a really complicated question, actually. So let me finish that thought. So, as we move into spaces where policies are being made, especially on the local level, I see some of you all from Eddie, from Lee, from Hobbs, these counties and cities, particularly in southeastern New Mexico, are trying to say that reproductive freedom and the ability to make personal decisions are not a value of that community. And I know that's not true. And so I think in the next couple of weeks, we're going to see even more of these so-called unborn sanctuary cities that legally mean nothing. Cities and counties cannot ban abortion. They cannot make up their own rules about sexual and reproductive health care. But what these resolutions do is perpetuate stigma and shame and make confusion and bring confusion for people who are already trying to navigate a medical system. So the last, so Teresa's asking, is it legal to access medication abortion through the mail? So, unfortunately, it's not a simple yes or no question. In New Mexico, yes. If you are in the state of New Mexico and your provider, you will have your telehealth visit, just like we've all gotten used to in the last couple of years. And if it's appropriate, you'll go through your intake, you'll have your regular clinician visit. And if you're in the state of New Mexico, yes, you can get your medications mailed to you, which is a particularly important access point for people in intimate partner violence circumstances. You can get those sent to PO boxes. You can get those sent to other addresses, right? If it's what you need to do for your safety. Across state borders, it gets more complicated. It depends on the state in which you provider and you patient are in physically. And so those are questions and conversations to have with individual assessments and with attorneys. And I just, I can't really provide like a yes or no whole hawk, but the federal, the FDA moved last year, time is a circle, to remove the in-person dispensing requirement that made it so people had to just, regardless, drive to a clinic to be handed your pills rather than get them at a pharmacy or mailed to you. So that is, and so there are some of the, so there are the ways of accessing abortion care within the medical system, when you go to, you go to your clinician and you have your exam and your intake and, all of those things within the state of New Mexico, just like how you would normally, right? Because it is healthcare. There are also people that self-manage their own abortion outside of the traditional medical systems. And, that has changed so dramatically in the last couple of decades, right? Because medication abortion is very safe and can be provided through consultation with clinicians over telemedicine. And so there are organizations and there are providers outside of the state of New Mexico and outside of the country who have for a very long time been providing medication abortion by mail to patients who need it. This comes with, depending on where you are, additional risk, additional legal risk for both the providers and for the patient. And so other states that we're seeing right now are attempting to make it a felony to receive this kind of medication through the mail. How they would enforce that, I have no idea. But, you know, people are really getting squeezed. And so, you know, understanding the risks. You know, we all work in risk every day. We get in our cars, it's a risk. We turn on the computer, it's a risk. And so understanding your risk continuum, your risk assessment is important, and helping patients and clients do that is also something that clinicians and lawyers and all of us do. But
I have a follow-up question with what you just said, that it's a felony, right, to like receive it through mail in some states. So when, you know, this came out in the summer, like TikTok is huge, obviously, right? A lot of women were saying, hey, head to your Walgreens. For those of you that, you know, can still grab all, you know, the abortion and, you know, pills or medication and have it to ship to somebody if somebody needed it. Yeah. So if somebody would do that, I mean, how would they know what's in the package? But still.
Yeah, no, I mean, so here's what like this, a lot of these laws, and I want to be clear, I'd have to check to make sure. The law is complicated. So there are lots of ways that a creative anti-abortion prosecutor person could decide to weaponize existing law to go after a patient, to go after a provider. That could already happen. Other states are, I don't know if these have passed yet, and I don't know how they would play out in the courts. It's still early days. You know, attempts to ban certain, you know, things through the mail gets us into federal territory, obviously. But every year we see attempts to ban certain kinds of medications. Here we see it. We see attempts in the legislature to ban certain kinds of medication that we know is about abortion. And so one thing to know, you know, what medication abortion, you know, for folks who don't know, are actually, it's a regimen, it's 2 pills. One of those pills has to be dispensed, mifepristone has to be dispensed by a certain kind of provider, a provider that is, you know, registered and licensed through, you know, the FDA and the company, and through their own licensure and all of this. And so, yeah, I mean, that's like another thing about social media, right? Is there can be a lot of misinformation that gets out there. And so, you know, these laws, as they're getting passed, like, yes, they have dramatic actual and practical impacts, but one of the things that they also do is spread misinformation and fear and confusion. And so, you know, I can't advise anybody to, you know, access medication outside of, you know, the medical system. I can't advise anybody to provide that medication, certainly not if you're not licensed. But understanding the web that people can get caught up in is really important for your clients and your patients. And so, you know, it's because healthcare is so highly regulated and because abortion has become so politicized, there are all of these extra layers that people need to consider when they're accessing care.
I think that there was one more question. in regards to the age, so curious about making sure we know the age at which a young person can seek medical help without parental consent, including abortion services.
Yeah, so I think I answered it earlier. So if you are pregnant in New Mexico, you can consent to your medical care, right? So young people who are presenting and who need healthcare if they are pregnant, they should be able to get the care that they need without interference. Again, and I think this is sort of where I was talking about clinical judgment and victim services work and helping patients, clients navigate a system that is not designed for any of us, but certainly for young people, it can be really, really overwhelming. And so helping somebody navigate that system is really important. And, if you are in sort of like this, a victim advocate role, a clinician role, those are conversations to have specifically with, your own attorneys and all of that. But in the state of New Mexico, if you are a young person and you are pregnant and you need an abortion, you can get one legally. Again, this is where victim services and clinicians will need to work with that person to understand their individual circumstance and what that person needs.
Thank you. I was like, I just wanted to make sure all the questions were asked.
And also, we do not have prohibitions on referrals. We do not have prohibitions on sharing information like other states. And so, when in doubt, help people make their own decisions, right? When in doubt, give people the right information, get them in front of the right people. So that's what I'll say about that as well. There's providing information to somebody you're working with is not a crime here, unlike in other states.
Thank you. Are there any more questions? And if you hear my little one, he's on fall break, so I'm pretty sure you heard that. But if you have any questions, please put them in the chat. Or also, in the email that I'll be sending you all in a couple of days with the recording and the resources that Ellie's going to be sharing with us, you can definitely have her contact information if that's okay, Ellie. And so that way, if you think of anything in the meantime, you can definitely email her. All right, no more questions. Awesome. Okay. All right. Well, go ahead, Ellie.
Because Sarah and I are like the same person. I can't help but jump in. This is an evolving and ambiguous time, and I wish I could sit here and say, this is what it's going to be tomorrow. This is what it's going to be in a year. This is what it's going to be in 5 years. There's just the uncertainty and the intentional confusion that is being perpetuated is a disservice to our communities. It's a disservice to all of us. And, we, the ACLU, certainly are in this for the long haul and are here as resources. But just know that if anybody is telling you that they have all the answers, they are just not telling you the truth. And so we are going to be in this together, and we're going to be figuring this out together to make sure that our clients and our patients get what they need.
Thank you so much. Sarah, did you want to add to that? Nope. Okay. Anybody else have anything else to add? Ida, Shauna?
Great information. Thank you.
All right. Well, thank you all so much for attending, and thank you so much for this very educational session. I know we had a lot of questions, and I think you really went through it with your presentation on the different laws and answering all the questions that we have. And again, if you have any more questions, please feel free to reach out. let us know if we can support you in any other way, right? I know that this is a big topic, as Ellie mentioned. If you all still need, to maybe expand on this topic, please let us know. Send us an email. And Ellie, you raised your hand.
Yeah, just offering up another resource, right? I usually say this at the top, but I think I was like, oh, we're all aligned on this, but everybody has a reproductive health rights and justice story. Like, we all come to this work, we all come to this space with our own experiences, information, understanding, and values. For folks in intimate partner violence, sexual violence facing careers, people who have experienced intimate partner violence and sexual violence, which, right, is like many of us in this world, figuring out how to meet survivors, how to meet your clients, your patients where they're at is just as important as figuring out where you're at. And so we can do what we have done in the past year is, train like how to talk about abortion, how to talk about sexual and reproductive health care, how to advocate for yourself on these issues. We've done these trainings before, and we've done Mythbuster trainings before. Y'all, we are heading into an election. We are heading into a legislative session. There are going to be so many lies told to us, to our clients, and to our patients about sexual and reproductive health and freedom. And if something doesn't pass the sniff test, if it sounds incredible, if it sounds unbelievable, it probably is. And so, as folks come to us for help, as folks come to us for advice and resources, right, I always encourage us to take a step back, right, and understand where things are coming from, and this work is it's not theoretical for any of us. We see patients, we see clients, we see community members every day who are just trying to navigate a really complicated system, multiple systems. We didn't even get to my favorite little exercise that we do. That's this is a person. These are the 50 things about this person, and these are the 50 things and systems that they're going to have to navigate. And it's all like this, and so, personal medical decision making, the decisions on how you navigate your life in a violent situation, politicians have no place in telling us how we do that. And so as we enter this season, our clients, our patients are living in that, where they're swimming in that water, being told that you should do this, that you should do that this should be your experience, that, oh, just do this, do that. We know it's more complicated than that. And you are some of the best advocates and voices to understand that and share that reality. So go forth and do that. We trust you.
Right. Thank you so much. And again, this is recorded. You all have access to it in a couple of days. As soon as our communications director makes it beautiful for you all, you will get your survey to obtain your certificate and Ellie's information and the resources. Again, Ellie, I cannot thank you enough for your expertise on this topic and coming on to create this space where we can ask questions and really learn about the laws and everything that's happening, right? Because it's really a lot of information and we have a lot of questions. So we're really, really grateful for you hopping on. And all right, well, you all have a fantastic day. It is 12:20, so we let you all out 10 minutes early. Please go have some amazing lunch, step away, get some self-care, enjoy the cloudiness, and we hope to see you at our next session. Bye, everybody. Thank you so much.